Hi everyone, my name is Jessica Savage Jones, and I'm a breast cancer research nurse at the University of Pennsylvania's Abramson Cancer Center. Today I'm going to talk with you about disparities in genetic testing. Over the last several decades, there has been a steady improvement in breast cancer survival rates. However, the mortality rate among Black women continues to be 42% higher when compared to non-Hispanic white women. This is especially true among young Black women who are both at risk for developing and dying of breast cancer. You may ask yourself, well, why is this? There are a number of complex factors that contribute to this. This may include genetics, tumor biology, and socioeconomic factors. Black women are far more likely to be diagnosed with triple-negative breast cancer, which is a very aggressive form of breast cancer that may contribute to disparities in survival. Furthermore, age of diagnosis and increased risk for developing triple-negative breast cancer are linked to higher rates of hereditary breast cancer. Hereditary breast cancer is breast cancer that is linked to genetic mutations that may be passed on by your parents or something that may appear in your tumor. Genetic mutations like BRCA1 and 2 and PALB2 are just a few mutations that are associated with the development of breast cancer. Hereditary breast cancer is associated with 5 to 10% of all new breast cancer diagnoses. Yet even with the availability of BRCA testing, there is still a lower rate of genetic testing among Black women. And this is due to disparities in access to genetic testing, systemic issues within our healthcare system, and follow-up care associated with genetic testing. Studies have also shown that Black women have lower provider rates for recommendation and discussion regarding genetic testing. The identification of inherited cancer risk can lead to so many things, such as cancer prevention, early cancer detection, treatment guidance, and ultimately has great potential to improve outcomes. Yet despite all these benefits, only 10% of women with BRCA mutations in the U.S. have had genetic testing, and only 20% of high-risk breast cancer patients are referred for genetic testing. Information learned from genetic testing not only has implications for the individual, but also for family members and also for future generations when it comes to making important healthcare decisions. However, if advances in hereditary breast cancer diagnosis and treatment are not widespread and aren't implemented, there's potential to further widen the existing breast cancer mortality gap among Black and non-Hispanic women. So as we continue to develop advances in breast cancer treatment by developing targeted approaches, it is important that we ensure equitable access to all women across all populations and socio-demographics. Because without this, we will continue to have disparities in breast cancer survival. This topic is so important because we could be saving millions of people's lives right now if we were able to get everyone the opportunity to have genetic testing. So each and every one of us is a part of the cure. So let's work together and use our voices to change the narrative. Thank you for your time.